Hi, my name is Carly Traylor, and I'm the Director of Strategic Initiatives and Student Affairs at NCPA. I am joined today with Whitney Brace from Liberty Hill Pharmacy to talk about our Community Pharmacy Fellowship Program. So Whitney, you're a pharmacy owner and you have a fellow in the program this year. What were some of the factors that went into your decision to join?
So I heard about the fellowship last year. Unfortunately, heard about it late enough, and then wasn't really invested enough and able to time-wise to do it myself. I brought on a staff pharmacist this over the summer. He's a recent graduate, and he's actually doing the fellowship with y'all now. And really, it's about practice transformation. And about having somebody trained, especially from people that are doing all of these things right now, of instead of making 50 different mistakes, of kind of cutting to the chase of this is some of the best practices on how to do this. Where it's a great opportunity for us and other store owners to get somebody clinically trained who can implement in the proper way all of these new great ideas that we want to do, that pharmacy's moving into a direction that's not just about dispensing.
So, two things that you said that I really want to focus on is that you used the fellowship as an
Mm-hmm.
opportunity to expand your staff.
Yes.
So you brought on a new
Mm-hmm.
hire, a new grad, and the fellowship's allowing you to kind of have this formalized training that also, so this is the second thing, taps into this like massive brain trust. So you get the collective knowledge of all of the faculty members who are USA luminaries and ACT faculty members, but you also get the collective knowledge of your other fellows. So what are they doing in their pharmacy? I was really inspired by our last dyad where we talked about immunizations, where we had literally the full spectrum. We had the pharmacy that only the pharmacists did the immunizations start to finish, and then we had the pharmacies that they're in states that are allowing techs to immunize. So you got to share that spectrum and that diversity of experience to say, how can I do that? How can I incorporate my technicians a little bit more into that role? So tell me a little bit, what's something that you've even seen? It's only been a couple of months into the program, but what are some things that you've gotten to notice that are bringing value to your pharmacy?
So the biggest thing so far right now has been workflow and optimizing why are we doing whatever it is this particular way that involves 10 other steps that aren't necessary. The biggest thing for me personally that I'm excited about is MedSync.
Yes.
We have had 3 or 4 different employees that have attempted to get MedSync off the ground, myself being the first one, and it has failed miserably. Where I would say prior to the start of the fellowship, we had 3 patients enrolled in MedSync.
Yep.
And yet none of their meds were synced together. So that's personally been my biggest excitement about it is, okay, finally going through people that know what they're doing and the how-tos, and okay, now seeing why, from talking to them, why our previous attempts have not worked. So that's my personal excitement about it.
I love that. And MedSync is such a foundation for all clinical services. And so we've talked to some other pharmacy owners that have shared with us that they've saved, like on average, $50,000 per store that they've successfully implemented MedSync, because it frees up all that extra cash flow. Your inventory is so much lower. So that's fantastic. So is that what you're thinking about for the capstone project?
Probably not, actually. I think
okay, so tell us what you're thinking about.
We recently were accredited as a DSME provider. We went through the CPS in Texas. They had a grant, and they went through a program with it where we recently completed that. And we're looking into doing something more of diabetic training, education. That my fellow went to the Dr. Kathy program on Friday.
Yes,
and so
creating
wanting to
help.
implement kind of wanting to implement that. So I think that's probably something that we'll be doing more as the capstone project.
That's fantastic.
There's a lot of great options to choose from.
I'm so excited to see your pharmacy grow in that area. So Whitney, what's something that you would tell somebody who was on the fence, like trying to decide if this is right for them?
If there's any sort of clinical activities that you're wanting to incorporate, and especially if it's things that you know your pharmacy can do and you just don't personally have the time to do, bring on somebody as a fellow, invest the time and the money in this, and it will absolutely be worth it.
That's amazing. Thank you so much, Whitney, for joining us. And if you want to learn more about the fellowship, please head over to our website at ncpa.org/fellowship, or you can send me an email at fellowship@ncpa.org. Thanks so much.